Nerve supply of the heart. The heart is supplied by autonomic nervous system. The heart is supplied by autonomic efferent fibers and afferent fibers. The heart is supplied by autonomic efferent fibers which control the rate and contractility of the heart. And we all know from physiology that sympathetic nerves increase heart rate and increase contractility. In contrast to parasympathetic nervous system, which decrease heart rate and contractility of the heart. The autonomic nervous system of the supply of the heart, the autonomic supply of the heart form cardiac plexuses, which contain also afferent sympathetic fibers, which convey pain sensation from the heart to the spinal cord. The autonomic nerves not responsible for initiation or propagation of cardiac impulse. Initiation and propagation of cardiac impulse is the function of SE node and other components of the conducting system of the heart. What is the origin of the autonomic fibers supplying the heart? The autonomic fibers supplying the heart are parasympathetic supply and sympathetic supply. The parasympathetic supply is derived from vagus nerve, from both right and left vagus nerves, which are the two vagi. The parasympathetic supply of the heart are actually preganglionic parasympathetic fibers, which arises from the vagal nuclei in the medulla oblongata. And we all know that the brain is formed of parts, and the lower part of the brain is medulla oblongata, just above the spinal cord. These preganglionic fibers passes through the following cardiac branches of vagus. In the neck. In the neck, both vagi gives superior and inferior, or upper and lower cardiac branches. Therefore, we have four parasympathetic branches from the two vagi. In each side, there is upper and lower cervical cardiac branches of the vagi. In the thorax, this is the superior cardiac, and this is the inferior cardiac branch of left vagus, and the same on the right side. In the thorax, the right vagus gives the cardiac branches, and on the left side, the cardiac branches are derived from left recurrent laryngeal nerve. Therefore, we have four cardiac branches from the neck, superior and inferior, or upper and lower cervical cardiac branches of the two vagi. And we have two cardiac branches in the thorax, one from the right vagus and one from the left recurrent laryngeal nerve. These preganglionic fibers relay in the parasympathetic ganglia in the wall of the heart. Therefore, all the course of the parasympathetic fibers to the heart are preganglionic parasympathetic, and the postganglionic fibers arise from the heart. Preganglionic fibers relay in terminal ganglia, peripheral ganglia in the wall of the heart. Therefore, the preganglionic fibers, which are parasympathetic, are very, very long, while the postganglionic fibers are very, very short. What is the source of sympathetic fibers? The sympathetic fibers, preganglionic fibers, arises from the lateral horn. All sympathetic supply of the body arises from the lateral horn of the spinal cord. The parasympathetic fibers passing to the heart arises from the lateral horn of the upper 5 thoracic segment. Upper 5 thoracic segments. These preganglionic fibers enter the sympathetic chain. Enter the sympathetic chain, and these fibers, these preganglionic fibers, relay in the 3 cervical sympathetic ganglia and in the upper 5 thoracic sympathetic ganglia. Therefore, preganglionic fibers arise from the lateral horn of upper 5 thoracic segments of the spinal cord. These fibers enter sympathetic chain. Some fibers, some preganglionic fibers, arise in the sympathetic chain to relay in the superior, middle, or inferior cervical sympathetic ganglia. And some preganglionic fibers descend in the thoracic sympathetic chain to relay in one of the upper 5 sympathetic ganglia. The postganglionic fibers passing to the heart through the following branches. Branches from sympathetic chain. First of all, the cervical part of sympathetic chain. There is superior, middle, and inferior cervical cardiac branches of sympathetic chain. Superior, middle, and inferior cervical cardiac branches. Therefore, in the neck we have 6 branches, 3 on each side from sympathetic chain: superior, middle, inferior cardiac cervical branches. In the thorax, the cardiac branches on both sides, left and right, arise from 2nd, 3rd, and the 4th thoracic ganglia. All previous parasympathetic and sympathetic branches form 2 cardiac plexuses: superficial cardiac plexus and deep cardiac plexus. What is the superficial cardiac plexus? The superficial cardiac plexus lies in the concavity of the arch of the aorta, in front of this ligament which called ligamentum arteriosum. Therefore, there is superficial cardiac plexus, which is the smaller plexus, lies in the concavity of the arch of the aorta, here, in front of ligamentum arteriosum. This plexus is formed of two branches. Branches sympathetic and branches parasympathetic. What is the sympathetic branches? Superior, left, cervical cardiac sympathetic branch. Superior left only. Superior left cardiac branch. This branch. The uppermost part called superior cardiac branch of sympathetic chain on the left side only. And the reverse in the parasympathetic. The vagus branch gives upper and lower cervical cardiac branches. This plexus is formed by the lower cervical cardiac branch of left vagus. Therefore, the superficial cardiac plexus is formed by two branches from the left side. One branch from sympathetic chain, which is the superior left cardiac branch. Superior, the highest one, and cardiac branch on the left side. Therefore, it's called superior left cardiac branch of sympathetic chain. And in contrast, the lower or inferior cervical cardiac branch of left vagus, both from the neck. Superior cervical of sympathetic chain and the inferior cervical cardiac branch of left vagus. These two branches form this small cardiac branch, which is superficial cardiac plexus, and this plexus gives branches to what? First of all, gives the branches to the large plexus, to the deep cardiac plexus. This is the deep cardiac plexus in front and below the bifurcation of the trachea. And in addition to branches to a deep cardiac plexus, we gives branches to the right coronary plexus. This is very clear here. This is the superficial cardiac plexus in the concavity of the arch of the aorta. Gives the branches to the deep plexus, deep cardiac plexus, and gives these branches which pass to what? To the right coronary, passing around the right coronary, called coronary plexus, right coronary plexus. In addition, it gives the branches on both sides, which pass with the bronchi to the lung. These branches passing on both sides are right and left anterior pulmonary plexuses, passing anterior to the bronchi, pass with the bronchi to the lungs, therefore pulmonary plexuses. And because they are anterior to bronchi, called anterior pulmonary plexus. This is the superficial cardiac plexus. Again, gives the branches to what? To the deeper plexus, which is the larger deep cardiac plexus. Gives the these branches to the right coronary plexus only. And here it gives only left anterior pulmonary plexus. Left anterior pulmonary plexus, not the right anterior. Left anterior pulmonary plexus only. because actually the arch of the aorta and the plexus below lies on the left side of the middle line, arching above the left main bronchus. Therefore, the branches passing in front of the left main bronchus to form a left pulmonary plexus only, or part of the left anterior pulmonary plexus only, not the right. Therefore, it gives anterior left pulmonary and the right coronary, and superficial branches passing from superficial plexus to deep plexus. The second and the main plexus supplying the heart is this plexus, which is deep cardiac plexus. The deep cardiac plexus formed of all cardiac branches from the two sympathetic chain and from the two vagal, except the left superior branch of sympathetic chain and the inferior vagal branch of cervical part of the vagus. Therefore, the two cervical superior cardiac branch from the left sympathetic chain and the inferior cervical branch of left vagus. All other cardiac branches form the deep plexus. Why these two branches doesn't form the deep plexus? Because these branches form the superficial cardiac plexus. Therefore, the deep cardiac plexus is formed of all cardiac branches from both sympathetic chains and both vagi, except the two branches forming the previous plexus, which is the superficial cardiac plexus. This plexus, which is a deep cardiac plexus, lying in front of the bifurcation of the trachea, deep to the arch of the aorta. Actually, it extends a little below the bifurcation. Therefore, it lies in front and just below the bifurcation of the aorta, deep to the arch of the aorta. What are the branches of the deep cardiac plexus? First of all, it gives many branches to the atria, to atria, and gives many branches to both left and right coronary plexuses, around the right and left coronary, and it gives branches to both anterior right and left pulmonary plexuses. These are the branches to both anterior pulmonary. Here, the deep cardiac plexus should give the two anterior pulmonary plexuses. Why? Because it lies in the middle line, in front of the bifurcation of the trachea. And branches of the deep cardiac plexus passing distributed to both sides in front of the bronchi to form the anterior pulmonary plexuses, while the superficial gives the branches only to left anterior pulmonary plexus, because the superficial cardiac plexus lies on the left side. This is the nerve supply of the heart and the superficial and deep cardiac plexus. Thank you for good listening and good luck.